Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and I want to welcome our expert guest, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book, No Time to Teach. It's a great compact little read for nurses and patient educators, and we'll tell you more about the book as the show goes on. Now, Fran, today we're going to talk about something from the book that specifically came out of the summary. And you were talking about setting priorities when you're teaching. And one of the items that is a high priority is teaching self-care skills to the patient while they're in the hospital. And this is something, obviously, you can't just leave until discharge. But many hospitals do that. But let's start with, what are self-care skills and why are they important?
Sure. Basically, anything we give as instructions to the patient, things that we expect them to do or want them to do, such as take medicine or change a dressing or do some exercise program. Those are the skills that we're asking them to do and that they need to know how to do. And sometimes we skip the assessment of whether or not they understand what it is we're asking them to do.
Yeah, and why is it so important that the patients really understand this and can do it?
If we just give them instructions and say, do this, and don't assess whether or not they can and they can't, then the health outcomes are going to be impacted. That they won't be able to do what we expect them to do, and we won't get the results we want, and everything is wasted, basically.
Yeah, and the ultimate bad thing that can happen is they wind up back in the emergency room or back in the hospital within just a matter of weeks for something that could have been avoided.
Exactly.
Yeah, and as we so often say, patient education is all about saving lives and keeping the patient healthy and out of the hospital. This is, when you shortchange this particular activity, you kind of put this whole prospect or function in jeopardy. Now, so often we hear nurses say, "I have no time to teach." We have established from episode to episode that there is time to do it, and there are tools to do it. Now, in thinking about self-care skills, what tools are available to most nurses to help with this prospect?
Well, the easiest thing to do is to pay attention to what care you're providing to the patient. Because in a lot of cases, whatever you're doing for the patient is something the patient will need to be continuing at home. So if you describe what you're doing while you're doing it, doesn't take any extra time at all, that's the introduction to teaching the self-care skill that can be done in no time.
Yeah. From personal experience, I can tell you that so often when nurses are doing some kind of a treatment or changing medication bags or things of that nature with the patient, they're talking about distracting topics like, "I like your earrings," or "so-and-so has a sale." And I know that they're doing that to help distract the patient, but it actually minimizes the impact they could have on the patient's knowledge about why they're in the hospital and what they need to do to when they get out. So don't be afraid of asking the patient what's on their mind or what are they worried about when they get out. Or using teach back or assessment to find out, what do they remember from, the last time you were in there.
Exactly. Yeah, there's a lot of opportunities, and you could probably have time to do the small talk too, because if you're repeating the same self-care skill several times, you don't have to discuss it every time once the patient gets it.
Yeah.
So there can be a balance.
Yeah, I think so too. And you can also use the small talk as an icebreaker because a lot of times patients are a little bit afraid to talk. So you can use the small talk about their manicure or whatever's going on, and then begin to ask some questions, assessment type questions, to kind of see, do they remember this, or let's go ahead and move forward in the next process and let's introduce something new. But before you introduce it, you want to find out what they know, right?
Exactly.
Yeah. Okay.
And what they're concerned about. You made a good point there.
Yeah.
Because if you can start with what they're concerned about, they'll be listening. They'll be paying attention.
Yeah, absolutely. And what are our two favorite skills to use to check and see if the patient understands and is absorbing what you say?
Well, teach back obviously
Yeah.
is my favorite, but with actual physical skills like changing and dressing, return demonstration, basically have them do it and show you how they would do it at home.
Yeah, and let me ask you this: would you have them do it on themselves after you've done it a couple of times, or would you have them just demonstrate on a different body part? Well, is there a right or a wrong way to do that?
It depends. There are also sometimes models or dolls that you can practice
Okay.
on for some things. Simulation is what it's referred to as. So it depends on what the skill is and how complex it is and how anxious the patient is and whether or not you have those tools available.
Yeah.
So it's basically play it by ear as appropriate for the situation.
Okay. Yeah, and trust your instincts, I would think.
Yeah.
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 Okay. Here's an interesting conundrum that I've experienced when you're about to leave the hospital. You may have interactions with occupational therapy or physical therapy or nutrition, or you have one or two other doctors outside the hospital that may or may not be in the hospital network that you have to deal with. What's the best way to coordinate all of those things to make sure that self-care skills continue and follow-up continues? Where does the burden lie?
It depends on the situation and in the environment, but often there are case managers who help coordinate the continuation of care after the hospitalization. Sometimes it's the nurse who arranges for the continuation of communications to the follow-up providers. So it really depends on the situation, but basically the key is communication, that everyone on the team throughout the continuum of care needs to communicate what the status is, what the expectations are, and then to let the next person know what's going on.
Yeah, okay. A lot of these things I would expect also play into behavior change. And of course, behavior change is difficult. We all have good habits and bad habits and behaviors that we do, and some of them we just do because they're a habit. If you're in the hospital for 3 days and then out, you're not going to change your behavior in 3 days. Are there any strategies for setting a patient up for understanding the behavior change and then following up? Do you depend on a family caregiver, or is this another one of those that's kind of patient and item specific?
There's basically two levels to patient education. There's the information giving and making sure people understand stuff, and then there's the application of that new behavior or change to long-term self-care. And what we're talking about is both, really, because if they don't understand not just what it is to do, but why you're doing it and why it's important and what would happen if you don't do it, that will play into whether or not the behavior is changed over time. So you really have to go deep in the conversation to make sure the learner understands what the point is, and that will help facilitate the behavior change over time. The other key is to get everybody involved. If there are family members and caregivers, make sure everybody understands and make sure everyone can do what it is that needs to be done. One of the things that comes to mind is when I work in a children's hospital, when we have a child who has a tracheostomy, a new one, and we want to make sure that there are at least 2 people in the family who know how to take care of that child, because you're not going to have one person always there.
Yeah.
So they both have to do return demonstrations and demonstrate that they know how to do everything that's needed to keep this child safe after going home.
Okay, and that doesn't happen just naturally. You guys have to manage that and coordinate that and force that in order to make sure the end result is met by the time of discharge.
We actually have something called nesting, where the learner is alone with the child in the hospital, in a hospital room, and they provide all the care. So the nurses don't even come in to check
Oh, really?
unless they're asked. We check to make sure everything's safe.
Yeah.
But in terms of the self-care, we let them be independent on it. So that gives them an opportunity to discover what they don't know or what they are uncomfortable with and get a little bit more teaching before they go home. So it's a really good test of that return demonstration.
Yeah, interesting. That's an interesting approach. I like that. Okay. Well, I think we're kind of at the end of this showtime. This topic is really interesting. This is definitely a high priority when it comes to patient education, because the failure to properly teach self-care skills to the point where you have high confidence that the patient understands what to do will go a long way towards reducing readmissions and that particular patient coming back into the ER or back to the hospital in less than 30 days or perhaps ever. And that would be the ideal thing, is that they don't have to come back. But this is pretty important. So it's incumbent on the nurse educators out there that every effort be made to teach these and make sure that the patient understands them, so that everyone has high confidence on discharge day, as opposed to bringing all this to the front on discharge day and having them just, with their hair on fire. So,
Exactly.
okay, excellent topic. So tell folks where they can find you online.
Oh, I have a website at www.notimetoteach.com, and I'm on Twitter at notimetoteach.
Okay, and also want to let folks know that your book, No Time to Teach, was the 2010 Book of the Year by the American Journal of Nursing, and is available wherever books are sold. Certainly at Amazon, you can get it in paperback and ebook form for your Kindle reader. And for those of you that want to use No Time to Teach as a reference for in-service training, and it's excellent for that, you can buy bulk quantities of No Time to Teach from the publisher, Pritchett and Hull, and their web address is p-h.com. So reach out to them and you can save 40% on a bulk purchase. And for hospitals out there that want to add some serious new tools to their patient education, we encourage you to look at video on demand, and you can check out our system, MMDS, or Medical Media Delivery System, at our website, synergybroadcast.com, and we'll put links in the show notes for you to take a look at that. So, Fran, thanks so much for your time and attention today, and I look forward to speaking with you next time.
Okay, bye, Chuck.
Bye-bye.